Hi everyone, Dr. Regina here, CEO and founder of Mobile Care Physical Therapy. Today I'd like to discuss a topic called Diastasis Recti. I will explain everything what it means, risk factors, causes of the DR, we're going to abbreviate it, and what are the things to avoid. What is diastasis recti? It's a midline separation of the rectus abdominis, which is our six-pack muscle, at the linea alba, which is a connective tissue right in the middle, in the center of that muscle. So imagine that muscle is separating, that abdomen is separating. So some studies, and that could happen to men and women. So we'll start with how it happens in women. Basically, number one is pregnancy. Studies show that at around 36 weeks, almost 100% women will experience diastasis recti. The prevalence decreases after 4 to 6 weeks postpartum to roughly 52-54%, and then continues to increase to 39% at about 6 months. So even at 6 months, some women that have the DR, they're still not fully back to 100%, right? Because this separation has to close. If not completely, it should close and be stronger, even if it's not completely closed. So after giving birth, you probably notice a slight bulge that was not there when you were pregnant, and it most likely will resolve in several weeks. But for some, it doesn't, okay? And you're still left with that hanging belly bulge, and or some people call a pooch, right? Belly pooch. So make sure at 6 weeks postpartum, when you go to your OB for follow-up, make sure you talk about this and ask for a referral for physical therapy. And even so, in New York State, physical therapy is direct access. If you decide personally to go and be checked out, you can straight go to a pelvic floor physical therapist. So what I'm trying to say, at the follow-up, ask about it and see what they say. They may check for diastasis recti and tell you the level of it and how severe it is, and if you have it at all, right? So if you do have that separation, and there's a lot of self-treatment out there on YouTube, you can check it out. But what I would love to suggest is get that assessment from a physical therapist. Uh, Check it out, check the level of it, and get the specific exercises for your level of DR, because there's so many different levels and things and factors that we look at, and then design those exercises specifically for you. Because it is person specific in terms of choosing that correct exercise, and then progression, therefore, for healing. So definitely work with someone that that could guide you in the right direction, because choosing those exercises off of YouTube, they're great, they're all great, but are they right for you? That's the huge question. So guidance is important. Some of the risk factors: pregnancy, right? For men and women, having and being over the age of 35 due to the connective tissue being weaker. So therefore the risk is greater for that separation. So that linea alba, the white tissue right in the middle of the muscle, is the connective tissue. For men and women as well, if there's a weight gain around the belly area, and obesity is also a risk factor for that separation of the muscle, diastasis recti. Improper training. What happens? Improper training or unbalanced training, which creates improper intra-abdominal pressure. Things like doing lots of crunches, different levels of crunches that you're not able to tolerate. You feel like you're able to tolerate, but we're not listening to our body that could cause that, um, separation. So those activities like planking activities, doing too much versus uh, doing the correct way, basically having quantity versus quality, right? Um, if you see doming or coning of your abdomen when you're doing the exercise or any type of activity, it is indicative of the diastasis recti. So the muscle that we're not usually training the transversus abdominis, um, it's the muscle that actually helps heal the diastasis recti. It stabilizes and um, supports our six-pack muscle. So other things like causes of diastasis recti is, it could be contributing to low back pain. It could cause organs bulging out, causing the hernia, the umbilical hernia or, abdominal hernia. And those are the things that we want to make sure that if we have DR, we need to treat it because, with improper lifting, heavy lifting, the training, that can cause not only that separation and leave that separation or have that separation making it worse, it can eventually cause hernia and other things like low back pain. So some exercise and daily activities to avoid and modify. So anytime we increase intra-abdominal pressure, we can aggravate the diastasis recti and the tissue in between, in the middle of the muscle. So like for bed mobility, when we get out of bed, rather than jackknifing going up straight, right? We should roll to the side and then push with the hands to come up to sitting and then eventually get out of bed. Okay, that will decrease that intra-abdominal pressure. Bulging abs can be caused by the doming or coning, can be caused by sneezing, coughing, blowing your nose, and every time, even with vomiting, that can be caused. So every time we do that, that can increase that separation, and eventually it could cause the hernia to develop. And because, it's all because of the increase of intra-abdominal pressure. So any activities that you can think of that increases that intra-abdominal pressure, we should be avoiding or modifying in a way that doesn't increase that intra-abdominal pressure. Other activities and examples are heavy lifting by bending improperly, so you're putting more pressure on that abdominal muscle and increasing that pressure, lifting away from the body. Again, overtraining while doing horse training. If it's not trained and your New Year's resolution is to go to the gym and exercise and take those classes, and you're not really trained before, that's a recipe for disaster. You really should be doing it gradually. So again, like deadlifts, deep squats, crunches, planks, forcibly twisting, those are all the things that would increase that intra-abdominal pressure, which eventually, again, separates the muscle and then causing other things like low back pain and hernia. So some people do close completely. Some, and some are not. So as long as that tissue is strong, we measure the separation by the width and the depth, how deep it is. So even if you have it still open, but the depth is strong and kind of like, when you push and kicks you out, right? It's strong and stringy. That's considered healed diastasis recti. Okay, and up to a finger and a half, it's considered normal. So in my next video, I'm gonna do a video on how to check for diastasis recti, and then I'll explain and go into detail and what we look at and how to test for the diastasis recti. So I hope it was informative. Thank you for watching. Subscribe to our channel, Mobile Care PT. Check out our website, www.mobilecarept.com. All our contact information and a lot more educational stuff is on there. Also, click on thumbs up to get notifications, and if you like the video, and to get the notifications, press on the bell button to get more new videos to come. And I hope you have a great week and be well and safe out there.